There is a conflict there. I mean, I have colleagues, friends, who would have no problem at all championing drugs harm reduction. You know, they would be very happy to stand up and say, needle exchanges are a vital part of any sensible public health approach. Of course, we should provide methadone and other opiate substitutes, you know, great benefit to individuals and communities. And then they would feel very uncomfortable saying, and vapes are a valuable public health tool. A lot of people would feel uncomfortable doing that. And it is partly because, you know, it isn't coming from the medical health establishment.
It's interesting because, you know, for those in the medical health establishment and public health that have come around to drug harm reduction in the last, say, 20 years, and many have. I mean, you know, many governments in Canada, for instance, very supportive of all of those efforts. And they often talk about how that we must respect the autonomy and dignity of the drug user because, you know, that's the way to support them. Yet they don't accept the autonomy or dignity of a smoker who's trying to save their own life using safer nicotine.
I think these smokers do seem to be one of the last groups which can be treated in a way that we, you know, just wouldn't accept with any other group. I can't think of an equivalent now, but you are right. And you can see this in the failure to engage with smokers or, you know, even representatives of groups that use safer tobacco products. It is, you know, it's remarkable to me. Actually, you know, these are somehow, and it's because, you know, you are talking about the same people. You could be talking, you know, when I am talking about David and his crack problem, I will be conscious of my language. I will not want to be stigmatising. I will, you know, want to hear. I would really appreciate his involvement when I'm considering my service design. You're not going to see a lot of that around smoking services or tobacco harm reduction yet. But I think, you know, we need, you know, smokers, and, you know, this is a reminder, do not live in isolation. You know, many of them will have other health challenges or have other issues going on. And, you know, we need to apply what we know works in other areas to this area as well.
All of this over nicotine, that's a shocking position to be in, considering, of course, your experience dealing with people who are addicted to much more unhealthy drugs.
I think nicotine, it does have its own sort of, it triggers its own responses amongst professionals. I think when we look at smoking, you know, I think one of the things that actually, that while people can say, true, you know, 50+% of people who smoke regularly are going to die prematurely because of their smoking. So actually, you know, it's how you consume your nicotine dictates the danger, and that's really high. I mean, you know, 50% of heroin users do not die from heroin. You know, so at that level, smoking nicotine is, you know, and yet we haven't really deployed, you know, the full range, the full arsenal of public health responses.